It didn't matter that we clipped his tongue tie. It didn't matter the breastfeeding or the breathing. He lived in my little unregulated body. And when I gave birth to him, I gave him those lovely unregulated issues. Hi guys, Melissa Mugno here. I'm the host of the podcast, and I want to thank each and every one of you for tuning in. You know, I wanted to do a bit of an intro to the podcast because I've been getting so much great feedback, but people asking, what if I know nothing about what you're talking about? What am I listening to? How can I share this episode? And I wanted to give you guys a little backstory. I created and developed Mind Your Mouth podcast because I wanted to have conversations with people in the space or the movement in which we call airway, self-help, nervous system regulation, because let's be honest, we're all human having a human experience, trying really hard to either sleep great, be able to manage our human behaviors, or develop and raise our children to be great people. And for a lot of people that don't realize, there is a lot of biohacking or low-hanging fruit that's out there, and that is called paying attention to what's going on in your mouth. And that's what each of these episodes are about. I'm talking to people that are either industry movers, leaders, doctors, medicine, functional health, or just people that are trying to make an impact and realizing that inside is where it all starts. And so I hope that these episodes make you look at things from a different perspective or open your eyes to an industry you didn't even know existed. If you feel called or you're interested, I can't ask you enough if you could do me a favor. If you could please subscribe, like, or share and send this to somebody who may be struggling or maybe feels alone, wants to develop a business, or is struggling to just feel comfortable in their own skin, it would mean the world so that we can continue to grow and also have a little fun while we're at it. Thank you guys so much. And please stay tuned and watch out for this next episode. Well, hello and welcome to another episode of Mind Your Mouth. My name is Melissa Mugno and I am your host. I am so excited today to bring on another guest that we get to meet and talk. This is actually somebody I have known, but haven't actually been able to have the opportunity to sit down and really have a one-on-one conversation. So I am so excited to have Brittny Murphy come on the podcast. Welcome, Brittny, and welcome to Mind Your Mouth.
Thank you, Melissa. I'm so excited and honored to be on here with you. I'm super excited. I too always wanted to sit down and have a conversation with you. We just never had the opportunity face to face. This is as close to face as I think we've gotten so far.
Yeah, I know. I think we've always been kind of running at a conference or, if you're there, vice versa. So I actually am really excited to have you on. You are the first myofunctional therapist that I've had on that isn't in the myosphere where people think I usually stay. And what excites me about that is because I think you and I can agree, it's about breaking those stigmas and those feelings that you have to stay in your box or in your lane, because I kind of feel like if you get into this world, you are kind of a boundary pusher, pioneer, a little bit of a, you shake things up. And I just think it's really important that we're all on the same mission and we should all be able to sit down and chat. Doesn't matter where you learned and what you taught. So for some of the people that are tuning in, we're pretty lucky. I do a lot of the, crazy woo-woo stuff. So I get a lot of my spiritual people that come follow, a lot of moms, a lot of students. So tell us a little bit of who you are, just so we get to know a little bit about Brittny.
Well, I think first, I'm a mom and a wife. That is definitely my mission in life, my priority. I love my family. I'm a registered dental hygienist is what got me into this whole rabbit hole that I've fully immersed myself in this airway world. I became a oral facial myologist in 2016, was my first intro course. And that was more like curiosity for me. I know one of the things people always ask is what got you into this field? And I didn't have a loved one or a partner or myself that had what I knew as airway issues at the time. I never heard the word airway dentistry until I took that first myo course. I was as newbie as they come going into this first introductory. Yeah, which again is not typical because most of us get into this because we have heard the airway buzzword or we have somebody that's struggling at home. And of course, like sitting in that room, I then realized all of these people, patients, family, friends, and whatever, that have an airway issue. But that wasn't really my journey into it. It was more just curiosity and knowing like there was something I was missing with my patients. And I had to know more because the thing I hate most is not having an answer for the people that I want to help. And I knew that I just wanted to kind of be on like the forefront of all of this. And so, yeah, that's how I went RDH to Myo in a very like non-traditional way.
So that's actually something you and I have in common. I did not go into Myo because I thought I had a personal story. Of course, we all ended up having one, but no, I went into it to solve a problem. We had implemented we were going to implement Myobrace into office and it was failing. And the only thing that we couldn't figure out was like these exercises became a really big issue. So I'm a hygienist as well, but I was a director of operations for 3 big practices in New Jersey. And we were going to throw it. We weren't going to do it anymore. And I knew there was like something to it. So yeah, I took my first class at Barry's office, Barry Rayfield in 2010, but it was mainly to figure out how to solve a problem. So yeah, it wasn't because I felt like, oh my God, I had a baby that couldn't latch and, so yeah, that's actually a similarity. It was, and then from there it opened the door. Yeah. It was a lot of people ask, how'd you get into it? I was like, solve a problem.
Yeah. And it's mind blowing because you think about it and it's like every single patient that sits in our dental chair, like they don't just have dental issues, right? They have these functional patterns that are driving those dental issues. And if you're working in any, like whatever kind of dental practice setting you're in, if you don't know about Myo, if you don't have a Myo that you refer to, like, you're kind of guessing on the stability retention of that case, And so there's just so many missing parts to dentistry that don't focus enough on the functional standpoint, right? And I'm sure that's something that we'll talk about today, but I just remember thinking like, not only is this like a new avenue that I want to explore, like as a business owner and whatnot, but also just making the level of care that I provide as a hygienist, like just taking it to that next level.
To the next level. Because that is the one thing I also saw while I was kind of getting to know you or like researching you a little bit. You and I also, there's a lot of, definitely that Northeast connection probably to the Connecticut, New Jersey thing, but you definitely appear not only in motherhood, social media, marketing, and everything you do. When you do it 180%. It seems like you are a detail-oriented, very, very polished, by the way, all your content, your girls, even your home. I was like, okay, that is a beautiful home when you put that up. So, but that's a testament to you pay attention to detail. So I definitely am sure pattern recognition, all of that stuff, because when we look at all the things you've done, you went out guns a-blazing. I had 6 years ahead of you and you are right up there as a forefront player. You went all in and didn't look back. So tell us a little bit about you personally. Who are you? Is that your personality? Things like that.
Yeah, you like literally hit the nail on the head. I am like, I'm either like all in. I'm either all in or nothing. Like that's the only way that I work in like literally all aspects of my life. And sometimes I do think that could be a negative for some things. I'm a go-getter. I am as type A as they come. Like my girlfriends and I, we have a conversation about this, like every time we're out to dinner. And it's something that I'm proud of, but again, something that I'm also working on because we're going to talk about nervous system and regulation and having that type A mindset sometimes works against me. But I do feel that like it's really helped get me to where I am. When I do something and I set my mind to it, like I am like 2000% in. And so, I look at it now, especially like being a mom, and I'm so happy that I did it all then, because I don't know that I would be where I am today had I also been a new mom at that point, right? Because one of the biggest challenges for me now and everything that I'm doing and trying to like live both of these lives to the full 120% I want to give to everything I do, it's presented as a challenge. I'm not going to lie, over these last 20 months that I've had my girls.
And yeah, and for everyone that doesn't know, she didn't just have one baby, she had twins. So one baby, I think, two guns, and they absolutely They are absolutely precious. I mean, what I've seen online, I mean, even if their personalities come out 10%, they seem to be full of life, big personalities, and they're not missing a beat. So that's a lot of moving pieces, husband, all of the all the things, because relationships matter, right? That's what this is all about, and making sure you can be present. And so, I just did a solo episode about perfectionism, and it's interesting. I never would have considered myself a type A personality because I'm way more of this other style, right? I'm not super detail oriented. I'm really big picture, which has helped me and hurt me in a lot of ways. I'm a quick start, but I struggled following through. But I think both of these different types of personality traits can help this mission work that we're doing, because human behavior is really the name of the game that we're in. I would imagine that's how I always look at it. Like, I just get the honor of being able to hang out with humans and get to know them really personally. And I'm deep. I don't like superficial.
Yep.
So I feel like you get to know some people in those areas. But perfectionism it comes in multiple layers, right? It comes in a lot of things. And I feel like a lot of people that we end up being surrounded with or working with or whatever, this concept comes up, and it comes up in different areas. So being somebody type A, probably a bit of a perfectionist like we all are, how are you navigating that with being aware that it is a bit of an obstacle?
Yeah. I mean, I feel like if we had this conversation even just a year ago, my answers would have been a lot different. And I think over the last year, I've grown so much as a person, because I'm just very intentional with what I say yes to, right? Like before, if you asked me a year ago, I'm saying yes to every single opportunity that comes my way. I felt like if I didn't, I'd be missing out, right? And it didn't matter what it was. My answer was going to be yes, because I felt like that was how I was going to grow. And although, like we said, yes, that mindset helped me get to where I am, I feel like once I became a mom, like I almost like had no choice but to kind of shift that, because my priorities were so different. I worked really hard to get my girls' hair. I mean, I have quite a fertility journey, and we can even go into that, because that even shifted my focus in that time leading up to having my girls. I think back to, so that was what? So 2022, we had 3 miscarriages within basically 12 months. So from October of 2022 to October of 2023, we had 3 miscarriages. I was able to get pregnant, no problem.
Just want to honor that.
Thank you. Yes. And I so appreciate that, because miscarriage is just such this weirdly taboo thing that people don't talk about, and they should, because there's so many women that suffer in silence. And that's why I decided to share my story. And it's a loss.
It's a loss. I mean, they're little beautiful spirits, and they were connected to yours. And I'm a big, I do a lot of work with like angel guides, and that's me. It's helped me be very close to God and all of those aspects. And I feel like angels are just these little, I call them the minions for God. They do all the, they walk around, and I feel like every one of those beautiful souls get to be your girls and yours angels. You're like the angel guides for your family, and they're there being able to support over that. But it is taboo. A lot of women live in silence about that and carry that, and then wear that pain all over their bodies. Their issues are in their tissues, and then they feel that. So I'm sure that's really helped you relate in different ways to all different women.
Oh my God, so much so. And, again, being like that perfectionism that we were talking about, like I struggled with it, where it was like, I knew that my mission was to have family. Like there was no stone that I wasn't turning to be able to sustain these pregnancies. Like IVF, what was that going to do for me? I was able to get pregnant. That wasn't my answer. So like, that wasn't something that I was going to just jump to. As we are in our field, like I want to know the root cause. If you can't tell me why I can't sustain this pregnancy, what is putting an embryo in me going to do? I've already had those, you know what I mean? And so I like immerse myself even further. So most people go to see a reproductive endocrinologist. I immerse myself in the immunology portion of it, because to me, about it, if I could get pregnant, but I would miscarry, to me, that tells me that my body is like, this is a foreign invader and we are going to attack. And so there was something not accepting in my body of these pregnancies. And so again, going the more traditional fertility routes just didn't really make sense to me. And so my priority shifted to that. And my podcast went from airway to reproductive immunology. I mean, everything I was doing outside of being with my patients was figuring out how I can start a family. And so then I even had the guilt of, am I not showing up enough for my business? I'm missing out. These people are going here, there, and everywhere to all these conferences. And I'm nervous to get on a plane because what if the plane ride makes me miscarry? Like at this point, like I wanted to live in like this bubble when I got pregnant that nothing at all could hurt me. That was outside of my control, or within my control, I should say, which is another thing that I learned to let go of control.
Because control is an illusion, right? Control is, it's a scaffolding of of these concepts, right? We really only can control ourselves, and build the awareness. I'm so curious, like I'm sure, were you able during that time to find connections with your, with your body, with the way you were handling things, from your nervous system to all of those aspects that were contributing or that you believe, and now is that now into your work?
Yeah. So I worked with a somatic coach, and it helped me so much because I feel like there was so much trapped trauma that I had that I didn't. And look, I'm a big believer in therapy. I think the first time I saw, a therapist, I was like 18, and I saw him for a very, very long time, and I love it. But there were still things that I don't think I worked out with relationships with other people, with relationships with myself. And so that was really helpful, and also helping me to just manage this thing that was just, I felt so out of control. And I don't do well with that because type A perfectionism, I want to take control over everything. And I did every little thing that I was supposed to do, and I still miscarried. And so it was, when I tell you, like, consumed me, like mentally, emotionally, physically, like I know that I wasn't showing up 120% in my business. And because of that, I felt like it wasn't fair to my patients. So I took a step back clinically. And luckily I have an amazing team of therapists, that are part of my practice. But I knew that I couldn't be the clinician that I wanted to be for them, because not only was I searching for these answers, but I was healing time after time. It's like I kept getting knocked down by a wave, right? Like I thought I was making headway. I'd get pregnant, I'd miscarry. And then a few months later, I got pregnant, I miscarried. And it was like, it was the most tumultuous time of my life. And we were newly married. I mean, I got married in June of 2022, and we had our first miscarriage in October. And so,
wow, it was,
yeah. And, at that time, you're supposed to be enjoying this beautiful newlywed period. And, it was hard.
You're in this dark era where, I mean, even for your spouse to be able to hold space for you, and then it's part of him, but yet it's not him, but it's him. Right. Like so many layers there. And then wanting to love you and support you, but you having so many feelings to that, which really bring up a lot of aspects of this. And, for a lot of people that might be listening, I have found this work in airway or myo it was the beginning of my healing journey. And I mean, it took me a lot of years. I make a joke a lot that, the movie Legally Blonde, the first one, when she's like, where were you when the girl's in jail? And she's like, I can't tell you because all of my, she was getting liposuction, but she owns this like workout clinic, because I had a pretty big, I was a pretty big, in the time, I was with Breathe Institute. I had a good thing going on in Vegas, and I was struggling inside, like wasn't sleeping. My clenching was out of control. My depression, I couldn't control my weight. I was on Adderall, Lexapro. I mean, I share it very openly. And I was drinking at night, and I was lecturing about the importance of breathing and sleeping and helping others, and couldn't help myself, and no one around me. But it was opening up the door for me to really think. And I mean, I had a pretty public, public falling in 2021 where I completely, lost my way. But I think those darker times or those heavier times is actually because now I'm like the best version of myself I've ever been, and so grateful. And now when I'm with a client, I get to kind of do it my way, like, and I do it the way that feels really authentic. And I
Yes.
feel like since you've had your girls, even your podcast and your content is so authentic and so kind of like I can't stop watching it. I don't know if you see, I'm probably like creepy top fan. I'm like loving it, loving it, loving it because it was one of the main reasons I wanted to talk to you because it felt it was like I could feel the energy from through the camera. And so I just hope you know that you are making such a huge difference on that side.
Oh, that means so much to me. It really does. And I agree. I feel like I have changed so much through all the stuff before my girls and my journey to becoming a mom and then becoming a mom and all that goes on with that too, and then again, running a business. I mean, so much that is expected from women in this world today is no wonder there's so many people out there that live in this state of dysregulation, right? Like they compartmentalize. They don't talk about it openly. They just keep doing. And then relationships with their spouses or themselves, fall. And there's just there's so much misinformation out there, I feel like, about what women should be doing today. Right.
Yes.
And
Yeah. Yeah. What I'm supposed to be doing, what I'm actually doing.
right. And so I feel like I got to a point where I was like, I need to just be very intentional with where I put my time and my energy. And that is really what I feel like I've been doing over this last year. And it's led me to a place now where I feel like I can live both of these lives and not feel like I constantly have to sacrifice either one of them. And it's work every day to be intentional and like kind of separate the two and make sure that I carve out time. And it might sound silly to like a type B person, but for me as a type A, I obviously thrive on routine, right? So part of like keeping my day calm and regulated is setting a schedule for myself that allows myself to be fully present in these things. Because when I wasn't doing that, it was like I was with the girls, but I wasn't present with them because I'm thinking about work. And then vice versa, I'm doing my work and I'm thinking about wanting to be with my children. And so I feel like I don't exactly have the recipe completely figured out, but I feel in a much more grounded place today than if we were to have this conversation last April. Oh my God, I was like a hot mess.
So then for some people that are thinking like, okay, Brittny, how are you doing it all? Are you doing it alone? You talked about having a team at work. So let's talk a little bit about the business model. So you own, right? It's Connecticut Myo, correct?
CT Oral Facial Myology. And then I co-own MyoWare.
Okay, MyoWare. So tell us a little bit about the business aspect and like what do those practices offer? What do they look like for, some of the other myofunctional therapists? How are they structured? How do they work?
Yeah. So CT Oral Facial Myology is my baby. That's what I started in 2016. And then MyoWare, I started with my partner, Joanne Amoruso in, oh my God, the years all blend. I want to say it was right around COVID. So 2020 or maybe 2021. I don't even remember. But anyway, so both of them are multi-practitioner practices. So we have in-office therapists and we also have strictly virtual therapists that do more of our virtual care for us. And I think so I met Joanne through the introductory Myo course that I teach. She was actually in our first cohort. I loved her. I adored her. I loved her energy and her passion. And she just reminded me so much of myself and just that mentality of I'm accepting that I'm forever going to be a student and I love every second about it. And I feel like that's a really important part when it comes to being a really good clinician. So I had brought her on to CT Oral Facial Myology. She was my first therapist that was on the team. And then from there, the busier that we got, it grew. She was in New York at the time. And, she was like, I really want to start something in New York. I'm in Connecticut. She's like, I'd love for you to be a part of it. And so we started MyoWare first based in New York. And then she actually moved to Florida. So then we've also brought MyoWare to Florida. So CTOM is strictly in Connecticut. MyoWare, we have physical locations in New York and Florida. And then both practices treat virtually. So CTOM has a team of about 5 myofunctional therapists. And MyoWare, we have, not including myself, because I don't really treat patients for MyoWare, there's 4. for therapists.
You're
And I think
you're managing all the protocols. I'm like, kind of, are you like considered, like, would you consider yourself like the clinical director, or like, are you overseeing
yeah,
those
so
roles?
definitely
Yeah.
more behind the scenes on both now. I've even taken a step back from seeing patients clinically for my private-based practice in Connecticut. I see them more on the doctor asks them to specifically see me, maybe more complex cases, things like that. Otherwise, yeah, I would say more advising from behind the scenes. Joanne and I are, working together to help, just propel the practice forward. And then for me, and again, my amazing team, I have a wonderful assistant. I'd be lost without her, like literally lost. I'm like, you literally can't ever leave me. Like you can't.
I feel the same. I have the same.
What do you want to be paid? Because I'll pay you that.
Yes.
But
Agreed.
honestly, because that part, like even hiring somebody to help me run the practice was a really huge deal to a type A control loving person. Like
Mhm.
to give up and relinquish that control and actually relinquish it and not like watch her and remove. It took me a while to get to that point, and I was really proud of myself. And, I think about it now, and that's one of the things that I'm always telling my students, like, once you get to the point where you truly feel like you're wearing so many hats, like you have to find where is your energy best spent? Like what is most valuable? Where are you most valuable in your practice? Because that's where you need to be. The other stuff can be delegated, and you should delegate it. Yes, you're now paying somebody to do something that you can do, but it's going to make your practice grow exponentially. And so just giving up that control, but like you mentioned, creating processes and protocols that are still, followed in the way that you want them to be. Because at the end of the day, when somebody looks at CT Oral Facial Myology, they're going to look back at me, right? Because I'm the
Yes.
business
Yeah.
owner.
Still your brand and your name and kind of your vision on that, which, that's actually that's a great segue, because I get asked a lot, and I'm assuming you do as well. I don't know about you, but myo in my mind has changed a lot, especially, from 2010, but even 2016. And I did I've been having a lot of conversations about this, is like, what does myo look like in your practice, in your mind when you're teaching? Because obviously you have influence. So, currently I really am looking at it like it's so much more than the tongue. And if you're only talking about the tongue, you're doing it a disservice, not because it's wrong, but because we've evolved and grown. So I'm would love your take and how you guys are handling that from an educational standpoint, and then also just a practice standpoint.
Yeah. So, I think, and I say this all the time, like, I feel like myofunctional therapists hyper fixate on the tongue. And like, let's even not get into the nervous system stuff for the time being, even though that's like number one. But like, we can't just focus on the tongue. Like, the tongue is one part of this oral container. Like, we can't not pay attention to what the lips are doing and the jaw and the teeth. Like, it is literally one system. It's not one single muscle. And so looking at the tongue in isolation, I feel like we're still going to fail, as clinicians, because if the lips aren't positioned correctly or the jaw's not positioned correctly, the tongue can't maintain the position that we want it to, especially during sleep.
Thank you.
Yeah.
Thank you
And
for saying that, because it's really, because there are sometimes I feel like I am talking to myself, because some people are like, Melissa, you go too deep. It's not repeatable. People can't do that way. And I'm like, I think they can. I just think you have to coach them and encourage them and show them a different way. I don't mean it to say, it's important.
Yeah. Oh my God. 1,000%. So I 100% agree with you. And if you just think about it, like, you can't keep a tongue posture like that. Like, that's just not going to happen. Like, never, ever, ever, when your jaw drops, is your tongue just going to magically stay up there? Like, it doesn't even make sense. And so getting therapists to really, again, look at it as this overall system. And yes, we know the tongue is a huge driving force in growth and development, but so is the position of the jaw and the lips. And so shifting that mindset and stop focusing on like tongue to spot. And even that, because we know more of the tongue needs to be up there than just the tip of the tongue to the spot.
Well, and how do you also, sorry, just like, you kind of got me excited now. Not often, like, even sometimes I've noticed I really don't even start with those positionings that we originally talked about. And you're right, because that's how we were all taught, was like, bring it to the spot. But if you are compensating so heavy and you are so in your head, or you're a child of a mom or a dad that's overly parasympathetic response. So I just speak, what was my big thing is I have a little guy. He's my bonus baby. He's 8. And I realized that he had all the typical airway issues. And when I realized I had every tool at my resource, there's nobody I couldn't call or couldn't do. And I had the best expanders, tongue, all of the things done. And I really had to look in the mirror and realize that his issue was that I was his mom. And that he lived in my little unregulated body. And when I gave birth to him, I gave him those lovely unregulated issues. My daughter hides them differently, but my son came out, and I realized it didn't matter that we clipped his tongue tie. It didn't matter the breastfeeding or the breathing. He needed to see me working on those things so that we could mirror each other. And it was crazy, Brittny. When I started to do my work, his stuff unraveled. And it really made me realize that you can't just, I gotta work with the mom before I can even work with the kid half the time.
Yeah. It's such, and like I learned all of this, right? As you did, I'm sure, about like nervous system regulation through the years. It wasn't like this topic or as huge of a topic of discussion as it should be. Like when I first started myofunctional therapy.
No one talked about it when we first started.
And not to like their fault.
Didn't know what we didn't know. Yeah.
Right. And we know so much now, and the huge role that the nervous system plays, because, at the end of the day, again, people hyper-focus on myofunctional therapy being just about the muscles or about prescribing exercises. And like, we have to think about what is really happening, right? Like motor learning, we're trying to carve new neural pathways between the brain and the muscles. And we're asking patients for a lot. We're asking them to build new patterns, new habits, develop coordination, and then carry those things into everyday life. And if your nervous system is in a state of stress, that is going to be very, very difficult. And then what ends up happening is clinicians think they're doing something wrong, or the patient's not trying. And it's not that they're not trying. If their brain is if their nervous system isn't in a state to accept the things we're trying to change with myofunctional therapy, it's not going to happen. You're going to fail. It doesn't matter if you're the greatest prescriber of myofunctional therapy exercises that ever existed.
Like hitting the nail on the head. How many therapists think it's them? And then, I actually just said something pretty bold in Switzerland. I said, listen, I care so much about this industry that I'm not willing anymore to allow clinicians to just think in a one-dimensional box, because the only way we grow is to do really amazing therapeutic modalities and really support our clinic, like support our doctors and set them up, because we all have this different way of going about it. And with that, I saw how much work you've done with the breath. One of the things I just looked at myself was I know how to nasal breathe. I wasn't a mouth breather, but because of how messed up my somatic response was, my central nervous was, my cadence of breathing was so out of whack. And so when you only teach somebody just to breathe, belly breathe, or you don't show aren't able to kind of like get into the issues with the maneuvering of breathing, there's no way you're going to maintain it, right? And be able to sustain all of these oral dysfunctions. So I loved, when I was doing my research, how much work you've done in breath between Buteyko and James. So, just to keep talking on what we're talking about, I'm assuming this all kind of unraveled at the same time.
Yeah. And I think in the beginning, I thought more, and I'm the same as you, Melissa. I've always been a nasal breather, but definitely a dysfunctional nasal breather.
Yes.
Like very shallow, a lot of breaths per minute. And so I think initially I was taught, like, can my patient breathe through their nose? And of course, yes, we do need to make sure that the patient can breathe through their nose, because that's the foundation of everything that we're trying to do. But also, like, you don't want to stop there. You want to use that patient's ability to breathe through their nose to help them regulate their nervous system. And again, when you can get them in that much better regulated state, the brain is going to learn better and coordinate it better and hold on to those patterns that we're learning. And we have to part of our job as therapists is helping the body and the brain get to a point to be receptive to the changes we're trying to make. We can't just shove these exercises down our patients' throats if they're not ready for them. And, then people say, well, how do I know? I mean, I think a lot of us can probably pick out a dysregulated patient, but, those patients that they're not progressing, they can't even focus enough to even learn the myofunctional therapy exercises, right? They're fidgety. You can tell that there's so much other stuff going on in their life. Maybe they're super closed off. They're not making eye contact. There's so many clues that you can see, even in a short 30-minute myofunctional therapy session, that you need to stop what you're doing and you got to go back to those basics and those foundations.
So when you are teaching or when you guys are working or how you guys are setting things up, how much of your myo program are you teaching is now more kind of catered to this breath, nervous system reset and not just the exercises?
Yeah. I mean, I think that I think we still need to teach both. I look at it more as like this addition. It's almost like this pre-step to entering their myofunctional therapy program. I also think that a really important part of a myofunctional therapy course is not only to be giving these therapists, of course, a tool box of exercises to choose from, but really getting them to understand what they're even doing. What muscles are they activating? What are they finding in that assessment that they need to prescribe that particular exercise? And then if that particular exercise isn't working or the patient can't do it, how do they pivot? They need to know like that clinical reasoning. And I feel like that's why we can't just learn exercises. We really have to truly understand what our goal is with them. And you shouldn't only ever have one tool in your toolbox for that specific, whatever muscle it is that you're trying to activate. And I feel very strongly the same way about even our airway dentists that we refer to, like a one appliance fits all method. It's just not going to work. And so we all have to have different tools in our toolboxes. And that's another thing too, that I'll tell my students, like, you're taking this introductory course. I'm not telling you that you're never going to want to take another introductory course or that you shouldn't. But I think what you should do after your first introductory course is begin implementing what you learned and then take a modality course, because that modality course is then going to take everything you learned and take it to that next level. So yes, in our course, we're focusing on nervous system regulation and things like that. But in an introductory myofunctional therapy course, it's so comprehensive. There's so many different things that we need to cover that I do think going on and learning even more and furthering your education and really all that is encompassing of the nervous system is so important.
Yeah, because it does allow us to evolve, find our niche, and it can be overwhelming for a lot of therapists. And I totally understand that where we are today is it's sometimes hard to remember when you first started and that you didn't come out the gate like this. Right. But with that, as we're in this like pivotal, I don't want to say pivotal, we're just in I think in a really good growth state right now. I had just made a comment, me and Zoggy and actually Dr. Kevin, we're talking about, it's a really exciting time in airway. And I think technology is a big reason for it, because what I'm seeing with 3D expansion and MARPI and so like that is really it's giving providers something a little bit more tangible to hold on to, especially for the ones that need more clear guidance to be told what to do. So that's exciting. Of course, there's obviously our pioneers, and I know someone you work really close with, Dr. Ben, who's excellent and really has set the stage for a lot of people and a lot of doctors to move forward. But this is, that pivotal mindset is an important thing. So yeah, let's go into that about providers a little bit, and how do you tell parents, how do they know what therapist to go to or what doctor to go to? How do they navigate this crazy world?
Yeah. I mean, I feel like when I go and talk to a practice and they're like, okay, so what you're telling me is there's this airway team and that it's not a one provider only type of treatment plan and they need to see X, Y, and Z based off of whatever, your findings are. Who do I send to first? And I'm sure maybe other providers wouldn't agree. I think you would probably agree as a myofunctional therapist, but I do always feel like we're a really good starting point, because I do agree. Yeah. like the quarterback of the team, right?
I call us
Mild,
the airway traffic controllers.
yeah, like mild always going to be a part of it. Maybe we're not the first people you need to see. Maybe I'm going to pass you off and you're going to come back to me. But a myofunctional therapist, I feel like, does a really good job at not staying siloed and really creating and nurturing and developing these relationships with interdisciplinary providers. And so your myofunctional therapist is either going to have that provider's name already that you need to see and can refer you, or can help navigate you to find the type of provider that's going to be best for you or your child, right? They know what to look for, what not to look for, the types of questions to ask, the responses that you want to hear. And I think that really important for a therapist is to meet patients where they are. And I think that, somebody once asked me, like, what makes somebody like a really good myofunctional therapist?
Yeah,
And I really, getting back to what you said in the very beginning, is like that human side to it, right? Like, there's things that you can coach into somebody, right? You can get them to recognize patterns and understand them and do an evaluation and know what's wrong and know what what dysfunction is going on. But I don't know that you can always coach like empathy and some of these other skills that we really need to be successful. Because as you and I know, a lot of these families come in and they are hearing all of this for the very, very first time, right? And it's overwhelming. My child has a tongue tag. They have airway issues. There's dysfunction literally everywhere, not even just my mouth. Now you're telling me their whole body has dysfunction. And it can be overwhelming.
Yes.
Like, yeah, I mean, I'm sure I know when I first started practicing, like I would see parents shut down in front of me because I was so excited to know this knowledge that I wanted to like literally shout it from the rooftops, that I would word vomit all over my face.
Oh my! If you sat next to me on a plane, and I was drinking, you should be careful. I was going to give you a whole myo exam, whether you wanted it or not. I was so like, if I could go, you know what? It's just the way I had to do it, but it was really bad.
Yeah, and it's, I think that it's so great that we're so passionate about all of this, but I also think that we have to know when to reel it in, right? And slow down and really understand that, like, our first role is really to be an educator, right? And we have to help guide this family through this usually completely new journey and extremely emotional. I mean, how many of us can think back to the hundreds of families that have literally cried in our therapy room because it's like somebody's finally listening to them for the first time, or like, I knew that it wasn't just something my kid was going to grow out of, and it was something that needed to be addressed now. And so I think the ability to like read people and understand where they are in that exact moment with their intentions, with their goals, with their emotions, like having those tough conversations, because we are educators. We do still need to educate our families, but we need to do it in a way that feels very supportive and not overwhelming, because we don't want them to turn off. We don't want them to leave and never come back. And I feel like those things are harder to coach into somebody, right?
Treatment. Yeah. Be able to treatment plan from intuition, right? Being able to connect to the patient and being, I use a little analogy with the students, especially hygienists. I go, if you're wearing loops or you use your magnification, it's our job now to come out of the magnification, right? Like, you have to be big. I mean, that's what we have to do for our doctors, to do all of it. It's really hard when we've been super focused on one area to come out here, because there's a lot of protocols that we know everybody can use, but we also, the elephants are in the room. I'm sure you still have providers around you that are against us. They'll say it's not true. They don't believe it. They give pushback. Show me the if I hear one, show me the research. Now I just say to them, show me your research. Show me your research that I'm wrong. But that's another, that to me is where I'm feeling the biggest empathy for families right now. I believe God put me back. I'm down south now and I'm in this, I did it when in New Jersey, and then when I was out west, and then down here. I mean, I feel like I'm starting all over here. Like, people, I mean, they don't turn their other head. Florida, there's areas that have grown, but there's areas. What are you telling your students or your parents when they're getting that pushback?
Yeah, I mean, I tell them how my experience was. Connecticut still doesn't have a lot of great airway providers. We have really awesome ones, but there's not a lot of them by any means. And I usually tell them like, expect to have doors slammed I mean, not literally slammed in your face, right? Like figuratively slammed in your face, but like
Uh-huh.
use that as fuel to keep going. Because think about how many patients live within one practice, dental practice or sleep practice or pediatric, like whatever kind of practice it is. Really finding that one connection can
Mm.
A, keep your schedule busy, and B, now you have another person that you can tackle this with to then go out and continue educating your communities. Like, be persistent, keep showing up, keep going to those local study clubs. There are always going to be naysayers. Like, I will never forget, I went to this, it was a more local, like female in dentistry study club. And I was like, oh my God, this is going to be awesome, right? Women pumping up women. This is totally my vibe. I
Yeah.
get there and this orthodontist comes over to me and she's like, I wanted to come over and talk with you before, but I just want you to know that like, I don't believe in anything that you do. And I'm like, okay. I'm like, well, you knew I was coming here tonight. They announced it last time you were here. So why are you here? Are you just
Yeah.
here to fight with me and rebuttal everything that I have to say? And it's just like, and even I still wouldn't give up on that type of provider. I mean, I usually do
Yeah.
say to people, like, is there some kind of openness to everything that you're talking about? Those are the people that I would spend more time on educating. You could always go back to the ones that think they know it all and their egos get in the way and whatnot. But you
Mm-hmm.
only really need this tiny little opening to insert yourself in to then just be able to drop all of this education on them that can completely blow their minds. And it doesn't happen overnight. I think, of course, depending where you live, but my experience wasn't overnight. It was a lot of persistent and
Yeah. It's
reaching out to
consistency.
providers. Yeah. And you have to be, and you have to have tough skin. And I think that I developed a tougher skin getting into myofunctional therapy, right? Not only to work with other providers, but let's just talk about even within the myofunctional therapy space itself, you have to learn to have tougher skin.
Absolutely. Well, I thank you for going right there because that was one of the most. So I was just at a conference this weekend that I don't think people expected me to show up to. And I was brought in because I do, same as you, I have some really great partnerships, that I'll support through education. And I walked in and there's definitely this feeling of like, well, wait a minute, you're not part of that. And I make a joke, sororities. I feel like we're all like different
Yes,
sororities.
I say that all the time. And I was not a sorority girl.
Yeah, neither was I. Actually, I made fun of my cousins that joined sororities. I was like, I don't need to pay for friends. I'm like,
Right?
I said, I go to all the parties. Like, but that is really who I am. Like, I've always just, first of all, I'm not a rule follower. Well, it's interesting. I'm not a rule follower, but yet I think it's because one of the things I learned about myself when just to go back on perfectionism, I think deep down inside, we all want to be accepted. We all want to be liked. We all want to be we want to be we want to be invited to the party. And sometimes when you feel like you're not understood or whatever it is, sometimes you might go the opposite way. And so I think I became this like, well, I'll just do it my own way. If I couldn't maybe 100%, fit into certain areas or whatever. But I always was a person that asked why. I like, even as a little kid, why? And I think curiosity is one of my biggest things I wanted to know, and naturally a problem solver. And my thing when I tell students or anybody is I just say, how good are you at doing puzzles? How much do you like solving problems? Because I think that also separates really great therapists. And so what I have found in our community is that there is a fear-based mentality, and that there is a lack of mentality, not an abundance mentality. And we are told that Brittny and Melissa shouldn't talk, and this one and this one shouldn't talk, or they don't like each other because they're doing the same thing. And I'll say for a little while I fell into that, but then I realized no. There's abundance. I just put a thing is like, I love money and money loves me. Like, it's all good because I don't want to live in that mind. There are so many people that need this work. And I keep going back to Burger King opened up across from McDonald's, and, they all have their own signature style and feel. And I hope more conversations like that break that, because is that something you've experienced? They almost want to segregate us. They want us to all stay in our lanes and our boxes, and you belong to these certain groups. Why do you think that is?
Oh, I 100% agree with you. I do feel like it's more a fear-based thing. And I think certain clinicians, I don't know if it's their territorial on this space, or they think that if another myofunctional therapist opens up down the street, that they're going to like steal all the patients from me. I don't even really know what it is, because we know that literally almost every single person is walking around with some kind of airway issue or OMD.
Yes.
So the abundance of patients is definitely there. I also think that people don't ask questions or get to know people. Like if somebody was to ask me like what my focus is, like I don't want to treat outside of my specialty. I know what I'm good at, and that's what I want to do. And if I'm going to take on a case that I'm like, I don't really know if that's something I should be doing, why am I going to do that? Because if I know that somebody else is going to do it exponentially better, of course I'm going to refer them. I don't want to take that on. That's going to reflect poorly on me. But people just assume. They just assume and they don't ask questions. And that's one of my biggest pet peeves about people. Like all of us, I hope, have a shared goal of getting our patients to breathe better, sleep better, and thrive. Period, point blank. That is what we're trying to do. And so why do we have to have these silos of other disciplines, right? Like I'm an RDH myo, you're an SLP myo, you're an OT myo, a PT myo. Like, no, we're all cumulatively a group of oral facial myologists. It shouldn't matter what our background is in. That is what got us here, to be able to get these patients to breathe, sleep, and thrive. But I wish, Melissa, that I knew what the problem was, but I don't. And
I think the fact is that there's not enough conversations. I think you said it perfectly. I think you do have to be a bit of that like pioneer mindset. And so sometimes when you do that, it can feel lonely. That's my one thing. I do think myofunctional therapy can be lonely, especially you go in, you take what course you take, that becomes your community, but they don't live near you. It's not like you're hanging out with them all the time. And then you'll go to a conference and you'll see them, but then it's like, the sorority, well, that's that group and that's this
you're
group.
Like on them if you talk to another group or something like that.
Yeah. And then I also think for another thing is what I had believed is and I think it's from some of our initial leaders, which they were just doing what they could to get the information out. Right. They made it that the exercises were like the secret sauce to Coca-Cola, like the secret recipe to Coca-Cola. Like nobody can know what sequence. Do you do tongue clicks or caves? Do you do and that was because they thought it was like, that was their secret. They needed to know it because if not, and I literally within our own community, Brittny, like I was at a conference and I'm sitting at a table and this lady asks me, she goes, "Hi, Melissa." I said, "Hi." She goes, "Can I talk to you?" I said, "Yeah, of course." My ego, I thought she was fangirling. I thought maybe she took a course. And she brings me outside and proceeds to tell me off that I am selfish. I think I'm better than I think that I'm better than her. And I'm going like, I don't even know who you are. Like I'm trying to, and she found out we were like doing a program and that we were going against something. And I remember looking at her and I just took a deep breath. And I said, "I'm going to say something that's probably going to make you more upset." I said, "But is your business not doing well?" And she said, "What does that have anything to do with it?" I said, "I think that has everything to do with it." I go, "Because if you changed your life and you went into this with all of your heart and you're not getting the response that you deserve, like that you want, and then you see mentors or people maybe doing things that you think could be undermining what you were taught, I get why you're telling me off." And she kind of didn't know what to say. She wanted to stay mad at me. She goes, "No, you just think you're better than me." I'm like, "Well, you really don't know me," because that's the least of it. But it made me go back and really think about the business aspect of this industry. And I think that is the fear, is that if you're not a great salesperson, if you're not comfortable in front of the camera, you're not making content, you're not doing a podcast, are we setting up the others? But at the end of the day, you have to own some of that responsibility. And I don't know if that is a little bit on us as leader or, as teachers or educators to let people know, it's not only about it's not just tongue clicking. It's not just the exercises. It's the art of having a conversation and being able to solve people's problems. And you know, how many hygienists or students, you know, have walked into practices and said, you need myofunctional therapy. I'm like, did they close the door? They were like, goodbye. I said, you got to go in and find a problem that they're having and solve it, right? Something like that. I don't know if you can relate to those things.
100%. And I think to your point, when you said like it being about the business part of it too, I feel like it takes more than just being a clinician to be successful. You have to know how to do the business part. You really can't, you have to feel comfortable being in front of people and being able to explain things and being put on the spot and being able to pivot and making these relationships. Like, we can't do this work on our own. Myofunctional therapy is an adjunctive therapy. It's not usually the only answer to a patient's problem. We're a very important part of it. But if you can't play well with others, like, you're not going to be successful in this field. And so to me, if I was that woman feeling the way she was feeling, what I would have done was come to you and network with you so that I can maybe have more doors open for me. You know, if you are in a community where you have access to, you know, for instance, like if some people want to get into the education component of it, right?
Yeah, which a lot do.
Yeah. Like, make relationships. And again, don't assume you know somebody. This woman never met you. Who is she to come and say that to you, regardless of however one portrays themselves on social media? Like, you don't know me. So please don't assume that you think I'm X, Y, and Z. Get to know me. And then if you think I'm a selfish B, fine. At the same time, like, and I always think back to, so I'm a big Taylor Swift fan, and I wasn't into music first. This is so funny. Okay. It was more, I love Travis Kelce. They started dating. I started listening to her, things like this. And then I'm like, wow, she is a badass bee. Like, she is such an incredible business owner. I want to learn all about her and how she became to be this like legend that she is. And so that's how I became a Swiftie. But she said in an interview, I think it might have been on the Kelsey podcast, I can't remember, but basically to treat your personal energy as an expensive luxury item that not everybody can afford. And that really stuck with me, because I feel like, looking back pre-myo, Brittny, and maybe the beginning too, I was definitely a people pleaser. But you can't be. Again, you have to have that tougher skin. Not everybody's going to love me. And that's okay. I'm not going to be everybody's cup of tea. And that's okay. There's going to be somebody else out there for them that will be their cup of tea. And that's just the way it works.
I'm still working on that. And I've always been a people pleaser. And the worst part is if that woman, if she only knew like the levels of insecurities I've had to go through, like, you know what I mean? And like how most people that are willing to get out there, it's because I was covering up an insecurity, or no one had imposter syndrome bigger than me. You know, I make a joke. I took Bill Hang's residency. I always could sell. I think that was one of my gifts. I could use education to sell, which I think you do very well yourself. But I realized I just needed to know. I don't know. Let me go back. I don't know where I started as an assistant. I don't know if you went right to hygiene. I had this amazing, I guess, mentor lady, a woman, say to me, to be great at your job, you need to know his job or her job better than yours, because then you're going to be able to set it up for success. And she said, you need to know every move. And I remember we were like doing a root canal, and I'm like learning about gutta percha, and I'm like trying so I could think of the maneuver before. So that's why I liked ortho, because as an ortho assistant, you have to pre-set it up for when the doctor would get there. So when I went to hygiene, I really struggled in hygiene. I hated hygiene, to be honest. I was not good at it. I really struggled in school, and I was bored because it was like very maneuver. So long and short was, when I got into myo, I realized I could pre-think things, and that's what allowed me to get better. So I would go take Bill Hang's course and get 2 doctors to go, because I wanted to hear what they were saying. And then I wanted to go to these rooms, and any major like business development person, they'll say to you, just put yourself in the room. And I think that's something you did. You were like, like when you guys started, just to tap before we close off, but like Airway Health Solutions, you on social media, all of these things you did, like you created rooms, you showed up in rooms. And if you weren't getting the conversation, when I look at your guys' group, you were like, well, then you know what? We'll just create the space. I mean, I even think of the ladies in the band and they're singing and they're in glitter and they're dancing. They make it fun, right? Like, so just tell us a little bit your relationship with all of that, with everybody over there, Airway Health Solutions and the things you're doing.
Yeah, I mean, that I feel like was really when the doors opened for me. And so when I first got connected with Lauren, and it's everybody always asks me, like, how did you meet Lauren? And I think Dr. Gelb connected me with her. I want to say how it happened. If my brain, as you know, mom brain is horrible.
Oh, please.
My brain is like the size of a pea now.
Doesn't get better.
I think I know that's what everybody keeps saying to me. I'm like, oh my God.
My daughter's 15. It's still
I think I had reached out to Dr. Gelb and saying, I knew I wanted to get into education. I knew that I wanted other hygienists to be armed with this knowledge to either just know it and be a better clinician in the operatory or go on and become a myofunctional therapist, because we all know that we need more of us. And so I knew I wanted to do that. And again, it's about who you know. Like, that is with literally anything in life, right? You want to make those connections. And so I reached out to him, and I think I had shared that with him. And I think he was the one that was like, hey, you should text Lauren. And he told me who she was and so whatever. And so I did. And Lauren and I got together. And at that point, Airway Health Solutions was just Ben's mini residency. And when I look at all that Airway Health Solutions has accomplished over the years, I mean, it is literally inspiring. It truly is the way that she has grown that faculty, and then how she's used that to also just propel this airway field forward and the overall awareness. It's really, truly incredible. I think that Lauren's an inspiration. So anyways, her and I relationship started with social media. She was like, my kids are going through a tongue tie release. Or was it her husband? I can't remember. I think it was her daughter. Let's document it. And those were like the beginning days of like social media and stories and doing lives and things like that. And so she and I did that. And then, obviously Dr. Morelli was teaching, and dentists are always looking for myofunctional therapists. And so they referred over to CTOM. And that was kind of like the beginning of our relationship. And then I got involved more in teaching, and we had a conversation with Lauren, and it just made sense for us to kind of like join under the Airway Health umbrella, because why not? Like, why wouldn't you want to be associated with a platform that can help propel you forward? Right. And so that's what it was.
That says a lot about your mindset, right? And that's what I really care. Like, so one, you picked up the phone and asked for something you wanted. You called somebody, hey, and then you sat down, had a conversation. And listen, Lauren and I, these last couple of years, I've been really grateful. We've been able to like touch base again. I need to invite her on, because she is such an inspiration and such a big force. And her and I ended up having a conversation, and there's so many similarities. Like, I'm so grateful for what she has done and how she's pillared. And then I've working with Dr. Kevin. Kevin talks her praises, like loves her. And we all have this space, but then you weren't afraid of collaboration, because some people could have been like, I could have done it on my own or whatever, but you embraced that. And it appears now you guys have built a really beautiful friendship, and you guys have great synergy on camera. Like I see, I mean, some people can fake it and it looks good, but you guys really appear to have a great relationship, and you guys all really seem to get along, which always makes it really nice too.
Yeah. And I think that's one of the things too that I love about Lauren, and similar to me, like, yes, it's hard for me to fake things. Like, it is written, like I might as well have it written on my forehead. Like, I might try to fake, but I can't. I just literally can't. It is written all over my face.
When my daughter says I do faces like, and she's like, stop. And I'm like, what? Like,
you have to get back to that abundance mindset. Like, that is so true. And that's really how Airway Health Solutions is. And I love that, because as we said, like, we can't do this on our own. We can't live in these silos. Patients deserve more than that. They need more than that. And we deserve to be able to be part of communities where we recognize the importance and the weight of each of our individual specialties.
Because we all have a voice. We all bring something big. And that's actually the one thing I've been really thinking is that, like, I love how you were even talking about like the scaffolding of like how everybody needs a great initial course, you need to learn the basics, but then you need more. And so with that creates opportunity in education that we're growing and being able to be so much with that abundance mindset. I love all of that. It's so exciting to hear all of those things that you're doing. And then let's just kind of, as we're kind of coming around here, I'm going to ask a couple questions that a lot of people we asked. So there is no joke, there's no secret that there's lots of conversation of like, where's myo going? Who's supposed to do it? Where's it supposed to be done? How's it supposed to be done? And I have my versions of answers. It's not like I get asked them too, so I wouldn't ask you anything that I haven't asked myself. But, and you can go as deep or as, simple on that as you feel comfortable with. But what are your thoughts? What do you say to your students? What do you say to people when they ask those questions?
So I feel like my answer to this has really grown over I don't know, maybe last probably 2 to 3 years, especially. I feel like there are a lot of avenues or ways for people to get into this space and become myofunctional therapists. And I think that that's great because it shows that there's growth in our field. But I also think that also means that there's more responsibility that goes into it all, right? Like if this space is spreading quickly, we also need to make sure that there is the highest level of care that is going to be provided, regardless of wherever we're getting our training, right? We all know that myofunctional therapy right now is a little bit like the wild, wild west, right?
Yeah.
And so I feel like we do have to have this safe way to ensure that people are getting trained properly. All of the educational components are being consumed in each of these, or presented, I should say, in each of these introductory courses. And so I feel like for our field to grow, we not only want it to grow, we really want it to grow the right way, right? And so in doing that, I feel like we have to have this level. And so I really do encourage all of my students to go through with their certification through the IAOM. And I really do wholeheartedly believe for our field to get propelled forward, for our field to be recognized as this subset specialty where we're not now so siloed as RDHs and SLPs and OTs and PTs and whatnot. Like we should really be looked at collectively as a group of oral facial myologists or myofunctional therapists, right? And in order for that to happen, I do feel like there has to be this unifying body or organization that is going to help set those levels so that it doesn't feel so much like the wild, wild west. And so I am under the mindset of encouraging my students to go on and get their certification through the IAOM. And I do hope that, all courses out there eventually will also adopt those values and certifications.
I appreciate that. That's really great. And, that's one thing I do know. I mean, I can speak. My own mentor, Sarah, has also been having them do it. There's always been a little joke. I have made it very clear. I've said, like, I have not chose to do it. And that was only because of my ideas that I partied with everybody. And then I've been doing it for so long. So I was like, I was doing it my own way and different things. But yeah, as we're getting more synchronized into a space, there needs to be a clear cohesiveness. I love, and I'm very grateful what Joy Lance has been doing for the hygiene community. It's important. And I'm so grateful for her work. I just saw her, this weekend. And I think that's really great. And I appreciate that so much. I just made a joke. I'd like to add a little more central nervous system and different aspects to the things so that we can keep evolving. But we got to start somewhere, and so I appreciate all the people that take on positions that I wouldn't be able to take on. I don't have the bandwidth. So
I think to your point of like abundance, like if more of us from all different tables all came to the same table, think how much we can build upon the existing education. If like you brought in your specialty as an educator and I brought in my specialty as an educator and everybody else that is doing, education. And then we knew that each of these therapists are either getting the same level or they're being then directed to, you need to go then and take. I just feel like we should all know about the different courses that each of us offer, right? Because again, similar to what I said about, I'm not going to be a clinician that takes on something that like bite off something more than I can chew. I'm going to refer them because that's going to reflect on me. If somebody comes to me and wants to know more about, I don't even know, a primitive reflex integration.
Yeah.
we'll touch on it in my course. Yeah. But if you want to know abundantly all about it, I want to know who I can direct you to. And so I like that part that Joy has really done with the IOM is really, again, I feel like the word abundance just keeps
Yeah, no, it's because it's a positive word. It's a word of us bringing things forward. And it again, just there is not a lack of, unfortunately or fortunately, there's not a lack of people struggling. There's not a lack of people wanting to help. And that for me to stay kind and centered with humanity, I have to believe that most people don't go into these things with ill intentions. And I think we all get lost. I think we all protect ourselves because we've put time and money and effort and we've sacrificed. And I totally can respect that. I don't have anything along that. And I just think everybody I've met when I finally just said, let's have a conversation, there's not really one person I've met that I don't, for the most part, see their side or am like, oh my gosh, they must bring such a different level or a unique style to whatever they do. I really realize what my passion is the business. I love the business of Myo. I love the business of getting doctors involved with money. I love startups. I like getting people to find their niche. And I really care about the mindset stuff. So I really took the last year or two to focus on that. I mean, that's what I care about. And I think the more we can all do it. And that has also showcased online. And with that conversation, which I want to thank you so much for being so open to have that conversation, because it's an important one to have. The last piece that comes on that I've been ending kind of the show with everybody is this. So social media, love it, hate it, AI, love it, hate it, whatever you feel with it. But it's not going away. And I love how much you've taken it on, because I am of the being that if you're opening a business in this day and age and you're not on social media, I don't know what you're doing, because Gary V said it a long time ago.
We're doing it.
Yeah, exactly. So obviously you own that, you're using it. Are you encouraging students to do it, or where are you at with that particular phase of things?
So, personally, for me, it's a love-hate relationship. If I didn't have to do it, I wouldn't, but I know I have to, so I do. I'm not a doom scroller. I don't love to be all up on social media. I could barely keep up with my own life, never mind trying to keep up with everybody else's life. But I feel like social media is really great for connection. I really do truly believe that. I have met some really great referral sources based off of social media in of itself, or LinkedIn, and of course other sites. I think that if you want to have a business and you want it to be successful, you have to have an online presence. I really, truly, wholeheartedly believe that. And so, yes, I encourage my students to do that. I also do encourage the use of AI. If there's things that we can be doing to make our day-to-day routine more efficient so that we can spend more higher value time with whatever it needs to be, right? If it's into growing the business, if it's working one-on-one with providers or educating your referral sources, that is where your time should be spent. So if we can streamline something through AI, in my mind, I'm like, why wouldn't we? That's right.
No, AI is, we have names. They're active participants of our team. We called ChatGPT Janet, because I love the Good Place. And, we call, Claude is Claude, and we all have the names of it. And we use, I don't know if you're open to share, but we use Heidi for Faceology, Heidi Health. It's HIPAA compliant. It's a little bit on the pricers thing, but it was the one that I could cover. And so Heidi comes to that meeting, and we have trained and learned. And so we make a joke. They're with us, we have them all around. And I have made it this year's mission. My team has had carved out time. We learn it, we train it, we use it, because I think it's not going to replace your job, but the person that knows how to use it will replace your job. That's just my feeling at this current time.
And I think you said this, it's not going anywhere. So it's either get on or get off the train, because you're going to miss out. Right.
Yeah. And it's not, I got to say this, good or bad, that's a conversation that you have to go deeper. It's just what's happening right now. And yeah, it's kind of like saying, think about how long ago we would have said, Instagram was, your parents said Instagram's bad or get your kids off of it. And it's now like the employee that's on their phone all the time. It's like, hey, good. You like being on your phone? Awesome. You're in charge of uploading content and social media.
Yeah.
Make a job out of it. We just heard a speaker say that. So we need more. I think it's going to be time. We have to do an AI social media course.
Yes. I mean, and honestly, because I feel like, even though all of us are much more exposed to AI than the older generations, there's still this fear with it or not knowing how to really utilize it efficiently. And it really can just help so much. So I think that that's one of the educational spaces that we're lacking, is something that can help other therapists learn how to integrate these types of services into their practice and how it can make their workflows easier on a day-to-day basis. So yeah, I think somebody needs to develop a course for that for sure.
Yeah, maybe I'll put it on the to-do list.
Right.
Well, Brittny, I could chat with you forever. And I really do. Thank you so much for just being so open. You are absolutely, first of all, adorable and so much fun to chat with. Your girls are a true, definitely have their mom's little glow about them. So that's really, really fun and exciting. And I hope that I get to hang out with you guys some more. And yeah. I'm looking forward to it. Last thing we ask everybody on the podcast we leave is we ask them a question and we say, when you think of the word or you think of the title, Mind Your Mouth, what does it mean to you? What do you think of?
I think Mind Your Mouth. I think the first thing that comes to my mind is really like the emphasis that we should put on this. Like this is, I think people forget that our mouth is attached to literally the rest of our bodies, right? And so I think that when I first saw your podcast come out, it just kind of made me think more of like a holistic mindset in a way, like more like this is so powerful in so many dimensions, right? And I think that more people need to be educated on that, not only of course from like the myo RDH background that we have, but even like the powerful things that you can do with your voice and having your voice and knowing that your voice matters. Like everybody should feel comfortable being able to voice what's important to them, being able to share their stories. I go back to how we started the podcast, like talking about kind of how I got connected with more of like the nervous system stuff through my fertility journey and things like that. When I use my voice to share my story on social media, at that current point in time, it was for me. It was more of a cathartic thing for me. I'm a writer. I could write and write and write. That's the best way I kind of let out how I'm feeling. And through that, I was not expecting for all the feedback that I got back from that of lives that I touched or people going through that same situation at that exact same time. And now they're not feeling alone. I made like really close friends based off of me sharing my story, or women that could relate who had miscarriages 40 years ago. And it's just, there's so much that we can do with our voice. And I think that like, that is kind of what I think about when you came out with your podcast and I saw the title.
Oh, well, oh my God, that was beautiful. Thank you. Cause that's, I just realized everybody's story really matters and everybody has a story. And I just wanted to give a place to have a conversation that was just a little different. So I thank you so much for giving me that opportunity. And I'm excited. So for everybody, thank you so much for listening. This was another episode of Mind Your Mouth. Until next time.